Hey, Dr. Rutherford here today. So today the topic, and we get most of these topics, by the way, from requests. So if you have any requests, keep them coming. Makes it easier on me to try to figure out what to talk about. So this one today is Hashimoto's and chest pain. And again, I refer to these questions relative to what I experience in practice because I've been in practice long enough that I think I've seen most of the trends and what occurs in my patient population, which is autoimmunity, which is Hashimoto's, chronic fatigue, different types of neuropathies, gut problems, food stuff, that type of thing. So chest pain. So the most common reason a person comes in here with chest pain from Hashimoto's is because of usually it's a combination or a division between stress and Hashimoto's inflammatory attacks. So let me explain that. So I'm going to take this to an extreme. I have a group of patients. I mean, literally, I have talked to a few hundred patients who have ended up in the hospital. Their heart pounding out of their chest. This was not exactly the question, okay? But their heart pounding out of their chest, and they go to the hospital and they get the EKG and they get all the echograms and they get everything taken, all the studies taken, and they get their bloods taken, and then they're told, hey, everything's normal. Go home, you need some electrolytes, you're just stressed. So to a certain degree, there's truth to that. But that person who shows up in the hospital is usually kind of a more extreme example of what this question is asking. So I get a lot of people who come in and say, my chest is tight. Normally, that tightness in the chest, and again, these people have usually already been checked, their heart's fine and everything. Usually it's stress. Now, most of the people I see, it's very rare that I see a person comes in here isn't in some sort of a chronic stress cycle. Stress is one of the triggers and exacerbators of Hashimoto's immune inflammatory attacks. So it's not surprising that that's part of their picture. And then that tightness is normally from the stress component. And so now you can then add to it that if one of those triggers, if the person has a blood sugar drop, or if the person has some sort of a food sensitivity, or any of these triggers, some sort of a chronic infection that's been activated, let's say it's a low level and it starts exacerbating and either starts damaging thyroid tissue, which starts vomiting out T3 and T4, the T3 and T4 thyroid hormones. That on a low level can create tightness in the chest. As you move up the scale, then it can actually cause a little bit of a chest pain. As you move up the scale, then you're usually going to start experiencing maybe your heart palpitating a little bit. But my observation, that doesn't happen in the, I wouldn't say rare, but the semi-unusual patient that comes in here who's not in some sort of a chronic stress response. Those folks generally are just going to get heart palpitations. They're not going to get that. They're not going to get that chest tightness. They're not going to get that chest pain. And understand, your ribs, you have sternum. You have these ribs that come from that attach to your spine. They come all the way around. They attach to your cartilage actually, and then that attaches to the sternum. If you start getting a lot of T3, if you start getting like a hyper attack, but maybe it's at a low level, it's going to increase the physiological activity of every single aspect of your body, including the muscles. So if those muscles start to tighten up, we're going to put a push on those ribs, or the muscles are going to shorten. There's going to be less movement in here. You're not going to be able to breathe as much, and you're going to get some tightness in that chest. So it's good that people go and get it checked out. Once they get it checked out and it's not some sort of a pathology in their heart, It's just something to know. It's part of your whole clinical picture. It's not something to get more worried about than your fatigue or your diarrhea or anything like that. It's just part of the whole clinical picture. Okay, so that's Hashimoto's and chest pain.